Good afternoon. Today we will have the lecture demonstration of the bag technique. But we cannot proceed with the bag technique unless we know the contents of the public health bag. The public health bag contains the following. First, you have two digital thermometers. We have just one digital thermometer here. One should be for oral and the other for rectal. This type of thermometer is mercurial and is no longer allowed by the Department of Health. To measure the amount of medications that are in liquid form, we make use of the medicine glass. To have the weight of particular object or thing, we have the weighing scale. To cut something, we could make use of the bandage scissors. Then, if you are going to measure a little amount of liquids, we have this calibrated dropper. To hold the test tube in place, you could have the test tube holder. Next, we have the different solutions and materials that are needed as disinfectant or antibiotic or for testing for urine, acetic acid, and also the Benedict's test. First, you have this isopropyl or ethyl alcohol that should be 70%, both an antiseptic and disinfectant. Next, this is your acetic acid. This acetic acid is just like the composition of the vinegar, and this is used for the determination of proteinuria or albuminuria in urine. Next, to come to senses for those individuals that are fainting, you have the spirit of ammonia. To test for the glucose or the sugar in the urine, we have the Benedict solution that is in blue color. You will know that it is no longer potent when it turns into colorless one. Then, contained in a translucent container, you have the povidone iodine. You have the most common brand here, you have the betadine. It is contained in a translucent container to prevent destruction of the halogen iodine by light. Next, you have the hydrogen peroxide or agua oxinada, still for the wound treatment but it's no longer widely used today. Then, you have the Zephyran solution that will be used for as antiseptic in washing prior to operation, for douching, and just like the povidone iodine. You have also this forceps to hold a particular material in place. You have this straight forceps and this is the curved forceps. You have roller bandage and you have a plaster. You could include likewise this one, we call this as the pen light or a small flashlight. This one is the alcohol lamp and should be with denatured alcohol. Next, you have this one as an applicator stick. It is sterile, so that's why it is being enclosed. This is like similar to these cotton buds with one edge having the cotton but with a longer handle. This one is the syringe with needle. You have 5 ml and you have also 2 ml. You could have a measuring tape. Then the kidney basin is used to contain something. Then cord clamp for the umbilical cord clamping after cutting of the umbilical cord rather. This is what you call the hand towel. It is used to wipe after washing to make your skin dry. This is a soap with the soap dish. It is encouraged that you have the soap dish without a hole to prevent from wetting. This could be the paper bag used as a waste receptacle, or you could have an extra plastic that is environment friendly, biodegradable, used to contain a particular material that is sterile or unsterile for separation of materials. You have the sterile drape here that is contained in a plastic. There are two types of sterile drapes here. The one that is reusable, the white one, that is a cloth. Then the other is made of paper that is of single use. Next, we have other materials. You have the cotton, you have the gauze. You could have also this one, the tongue depressor, the face mask. You have the sterile gloves. Next up, you have the apron. Then you have the paper towel, or this is newspaper or any paper that could be used as lining. Then you have a plastic lining likewise. Then you have this public health bag that will contain everything that is described here. And lastly, not included inside the bag, you have the stethoscope and sphygmomanometer.